Hello everyone, my name is Chrissy Nappy and I am the Project Manager for Marketing and Communications at Nurture. I'd like to start off our session today by welcoming everyone. This is the fourth webinar we are presenting this year and we're glad to have you join us today. Our presenters for today's webinar are Dan Cave and Kyle Blumen. Dan is the President and CEO of Nurture. With more than 25 years industry experience, Dan is a visionary who has seen the evolution of healthcare and the emergence of the new healthcare consumerism. He provides strategic leadership and direction to guide Nurture on our journey to help people address the barriers that get in the way of health, as well as the health issues that complicate life. Prior to Nurture, Dan held positions as Chief Operating Officer at Cardium Health and Cigna Pharmacy Management. He also served as President of Specialty Health for Prudential Healthcare. Earlier in his career, Dan held a variety of senior executive roles with the Travelers and founded one of the country's first disease management firms, Calm Inc. in New York City. Our co-presenter for today's webinar is Kyle Blumen. Kyle is the founder and president of Wellness by Choice, which is a company acquired by Nurture in 2010. Kyle's personal journey in healthcare inspired him to establish Wellness by Choice with the vision to help organizations reduce healthcare costs by improving the lives and health of individuals. As a member of the Nurture leadership team, Kyle leads the day-to-day operations for Wellness by Choice and also collaborates with the technical, clinical, and administrative staff at Nurture on integrated health and wellness initiatives. I would also like to tell you a little bit about Nurture. Nurture is the life, health, and wellness company that helps people transform their lives and well-being with education, life balance, and motivation. Our approach combines intensive motivational techniques with educational resources and tools to encourage healthy behaviors, promote healthier workplaces and communities, improve productivity, and reduce healthcare costs. Our mission is to deliver the best outcomes and greatest return for every dollar invested in health. Before I hand things over to Dan and Kyle, I would like to mention a few housekeeping items. First, due to the large number of participants in today's session, everyone's phone line has been muted. If you have questions during the presentation, please submit them at any time through your participant panel, which is the icon in the lower right corner with the question mark on it. At the end of the presentation, we'll review all questions, and Dan and Kyle will field as many as time allows. And at this point, I would like to turn things over to Dan and Kyle.
Thanks, Chris. When Kyle and I sat down to think about doing another federal health reform webinar, for all of you folks who have taken time out of your very busy schedules to dial in today, we really wondered whether we should go through this and rehash what has become certainly a topic that has received a lot of attention recently. Do we go back through the key provisions of federal reform as it relates to our client base and kind of do what seems to have been done many, many times in the past several weeks by other entities? And in all honesty, as we thought about that, particularly in light of the recent midterm elections, which raised the specter of possible partial repeal of aspects of federal reform, or perhaps even full repeal, or even delays in implementation, again, we sort of questioned, does it make sense to go back and do yet another webinar that explains various provisions of federal reform? And as we thought about that, that was kind of one set of thoughts, but the other set of thoughts we had was certainly that our customers have been asking us about it. More specifically around what to do in light of federal health reform. Our customers really, at the end of the day, are worried about the success of their enterprise, whether it's a business or a union or a health plan. Questions arising on federal reform are more around how is this going to impact the success of my enterprise. The people that we coach, the individuals in our programs, they also express to us concern and questions about health reform. But for them, it's a little bit of a different question, not driven about success of the enterprise that sponsors their benefit plan, but rather Will they be able to afford care personally? And will they be able to access it in a timely manner? And will it be quality health care when they need it? And the more that Kyle and I thought about this, and the more we reflected upon some of those questions as it relates even to our own personal experiences with health, we felt we were compelled to speak on this topic. Frankly, the hundreds of pages that we've all reviewed as it relates to health reform, to Kyle and I, seem to beg a question, a very big question, almost so big that we think of it as an elephant in the room. So we felt we had to do this webinar and talk about some other aspects of federal reform that may not be getting as much attention. To do that, it's going to get personal today. It will not get political, but it will get personal. So we're here to begin a dialogue, this personal dialogue. Before we do that, I note that everyone who's dialed in this afternoon is doing so probably representing something. You're here representing an employer. You're here as a consultant. You may be here as a competitor. You're here as a union representative. You have responsibility for some segment of population that whose health is of concern to you, either for financial reasons or productivity reasons or whatnot. But you're also here as yourselves. You're here as people who will experience federal reform as it's been created by Congress. And so our conversation is really going to touch on both of those aspects today. But it's really going to focus on this question that I'm hinting at, that we believe is being begged, that is an elephant in the room, that is not getting a lot of debate on TV news shows or in the media, but rather something that I think we all must confront ultimately in a very personal way. So to begin that process, what I'd like to do is start to speak a little bit towards what we think about reform. And to do that, I'm going to rely on some data that is very recent, from November of 2010, from the Kaiser Family Foundation, who does great work in terms of gathering information around healthcare. And this slide that you're seeing on the screen now really is just some selected data from the recent November 2010 tracking survey that the Kaiser Family Foundation went through. And I'd like to point out first on the left portion of the slide, this presents data that was in response to a question to survey recipients as to the top two factors that mattered most in deciding how they voted in the midterm election. And this is very interesting data. Despite all the political rhetoric, despite all of the noise and sound bites, we all heard about healthcare reform. It interestingly was an influencer of how people voted, but it was not dominating how people voted. If you look at this chart, you'll see that the number one factor in how people voted, the number one determining factor, was the economy, with nearly 30% of Americans reporting that as one of the top two factors. Next was political party affiliation, long-seated, deep-rooted political party affiliations. And down on the list a little bit further at number 4 was indeed healthcare reform. So it certainly influenced how people voted, but it did not dominate how they voted. Secondly, in the upper right-hand corner, the Kaiser Family Foundation posed a series of descriptors to Americans and asked them whether or not those descriptors described how they felt about federal reform. And interestingly, I think the chart on the upper right says we're confused. Half of us are confused about how we feel about reform. The other thing that I think is interesting is that we seem to be equally split, with a third of us being enthusiastic about it and another third of us being angry about it. In the bottom right, you'll see whether or not people feel positively or unfavorably about the law. And this is fascinating to me because despite the fact that half of us are confused, we seem to have formed opinions. Interesting as to maybe what those opinions are based on, but we're confused. One in every two of us are confused, but we seem to be split evenly between whether We think it's a favorable law and favorable reform initiatives, or unfavorable, with just about equal distribution between those two attributes. 42% feeling that healthcare reform is favorable, 40% feeling it is unfavorable, and the remaining 18 either not responding or did not have an opinion one way or another. So despite the confusion and despite the rhetoric, we have formed opinions. And what does this all suggest to me? To me, this suggests noise in the system. It suggests confusion. It suggests a lot of emotion. Frankly, it suggests the influence of rhetoric and the influence of sound bites and headlines, more so perhaps than real deep thinking around facts. So before we go much further, it probably now makes sense to at least fly at 80,000 feet and take a look at healthcare reform from a very, very high level, an attempt to get clarity around what health reform was attempting to do. And so I'd like us to focus for a moment now on the intent of health reform. And while there's a lot of contentious debate around various provisions, there's even confusion, I think when we think about intent, there isn't so much debate, and there probably isn't so much confusion. I think it's relatively clear what Congress was attempting to accomplish. The debate may be around whether or not they did it or how they did it. But let's start with access to health insurance. Certainly, all of us as Americans have heard of the 30, 40, 50 million uninsured fellow citizens of our country, and none of us can feel good about that. And so I believe that Congress certainly was attempting to address the issue of lack of health insurance for so many Americans. And so access to health insurance was certainly something that appears to be high on their minds. Secondly, we've also all heard about stories of waste in the system, of healthcare services being provided that perhaps were not necessary. And so I think there is a goal embodied in reform to attempt to eliminate waste in the system. And then thirdly, I think there is the beginnings of an attempt to improve the health status of citizens in the country, that there's some legislation that was attempting to do that.
Dan, I absolutely agree with your assessment of the law's intent. When you look at the intent, certainly access, right-sizing, appropriate utilization, as well as improving the health of our society, absolutely were the long-term intent of the law. So I guess a good place to start talking about this is to looking at the intent for access. And when we look at the law, things like expansion of Medicaid coverage, the individual mandate that shows up in the year 2014, and the coverage that's been extended to dependents up to age 26, absolutely address the access intent that we're talking about here today. But when you talk about right-sizing or appropriate utilization, as well as improving the health status of our society, you really can't talk about that without being part of the discussion surrounding ACOs, or accountable care organizations. The ACO, being a legal entity, is built on three major principles. One being accountability for a defined population of patients. Two being reforming payment. It's really a shared savings model that's being developed between ACO members, and starting to measure performance in terms of outcomes. So really the ACO's intent is to focus on defining appropriate utilization as well as improving health status of our society.
That's I think that those points are well taken, Kyle, and I guess the part that's intriguing to me as you talk about being responsible for populations and whatnot is that for the first time, at least in my recollection, I think we're starting to see some federal legislation that is touching on health status of the population. Certainly, we've seen legislation like that in the past, but it seems to me that it hasn't been at the federal level. It has been